Just a few weeks now until the start of the NFL season. Players are already starting to report to training camp, and the NFL is doubling down on efforts to get more players vaccinated. This week, we learned that if a team experiences an outbreak among unvaccinated players, they may have to forfeit a game. And tonight, according to Bleacher Report, unvaccinated players may even be fined for breaking COVID protocols. Joining me now is the Chief Medical Officer for the NFL, Dr. Allen Sills. Dr. Sills, thanks for joining us.
Hey, thanks for having me.
So the question is, off the bat here, is why go through the circus of fines and forfeits? Why not just mandate the vaccine for players like you do for coaches?
Well, all of our COVID protocols are collectively bargained between the NFL and the NFL Players Association. And so this is the agreement that those two groups have come to. We've elected not to mandate vaccines at this point, but we're doing all that we can to educate and hopefully persuade all of our players to take the vaccine.
And how is this COVID policy being received so far by coaches, staff, players, and fans?
Well, I think that everyone references back to last year, and they know that there's a lot of aspects to this, but that's what allowed us to keep safely on track last year. And so I think there's a trust that we earned last year with what we were able to do. Clearly, we know we've got a big challenge in front of us, but one of the things that made us successful last year was everybody pulling in the same direction: coaches, players, staff, league officials, Players Association. We all were dedicated to the task of staying safe and moving forward, and that's what we're aiming to do again this year.
Understandably, but when it comes to the vaccine, clearly not all the players are moving in that same direction. There are a number who are speaking out against these new rules. Why don't they want to get vaccinated? What is your message to them?
Well, I think my message to them is the same as it is to my own patients. I mean, I'm still a practicing physician, so we have these conversations, and that is, let's understand the risks, but also the great benefits of the vaccine. And I think personally, these are some of the safest and most effective vaccines we've ever developed in medicine. I think they clearly do a fantastic job of protecting us against serious illness or death, which are the things that we most worry about. And so we just want to share that information and make sure that people have accurate information. We also now have over 3 billion vaccines around the world, so we've got a lot of experience to reference about what the side effect profile may really be. And I'm very confident that as we continue to share that information, we continue to gather data, people are going to understand just how important these vaccines really are to allow us to move forward.
And as a doctor, you're focused just on the science, what the data shows. What do you say to players who have been tweeting out to their millions of followers about this, saying that they're being forced to get vaccinated? What is your message to them?
Well, again, as we said a minute ago, we're not mandating this. We're trying to share information. We truly believe collectively as a league and the Players Association together that being vaccinated is what will keep us in the safest possible position for all of us in the league and all of us as a country. So we want to share that information. We want to address misinformation that's out there and just make sure that people really have the medical facts and understand how it affects them and their families.
And understandable that you are not mandating it. It's worth repeating that. But some of these players have tweeted that they feel as though they're being pressured into it. So have you talked directly with any of these vaccine skeptic players? What are you hearing from them?
Well, I've spent a lot of time talking with our clubs, with individual players, with family members, obviously with our team medical staffs and others. And again, our policies and protocols are not about punishing people. They're about trying to be as safe as we possibly can. And we believe, as do medical experts, that being vaccinated does put us in the position to be as safe as possible. So that's really our focus, is how do we maintain the safety of our club environments, allow us to move forward through our season just like we did last year. And so everything we can do to incentivize vaccination is something we want to do, but our protocols are built around that idea of let's be as safe as we can, not about punishment or disincentives.
Right. I saw you talked to reporters yesterday, and you said, we shouldn't be paying attention to Facebook and Instagram. And it raises the question, how much is social media to blame for vaccine skepticism? For some of these people, players getting their information from social media on the vaccines rather than trusted scientific sources?
Well, I think that's our focus. You hit the key word there, which is trusted scientific sources. And so we all know that we look to influential people who we trust. Again, that's what we do as patients. That's what we do as family members. And so we just want to make sure that people have access to reliable and accurate scientific information. That's what we and the Players Association together are trying to provide to our players, coaches, and staff.
But how are you able to get them to put more weight on these trusted scientific sources rather than, what they're seeing online. Do you see any movement on that front? Do you see that your efforts are actually working and that you are getting more vaccine hesitant players to get vaccinated?
We're seeing a daily uptick in the number of vaccinated players. As of yesterday, 80% of our NFL players have started the vaccination process. And so we are seeing those numbers go up literally day by day. And so I think the message is resonating. We've still got more work to do, but we're off to a good start. And so we'll continue to have those conversations. I've often said I don't believe you shout anyone into changing their opinion here. I think you just have to thoughtfully address concerns, share accurate information, and help people as they make these important decisions for themselves.
And you are certainly making progress. I read that 2 weeks ago, I think there were 2 teams that had less than 50% of the players vaccinated. Now every team in the NFL is over the 50%. But of course, you want to get to that 85 and above threshold. We've seen outbreaks among vaccinated players, though, within Major League Baseball. So what are the consequences if there are outbreaks among vaccinated players and the NFL? We're seeing breakthrough cases among vaccinated people. I want to point out to our viewers, they're rare, and people who have a breakthrough case and you're vaccinated, you likely won't end up in the hospital or die. But what about vaccinated players getting breakthrough cases?
Well, we all know that you can still get COVID infection if you have a vaccination, but clearly being vaccinated protects you against more severe illness and certainly severe outcomes of hospitalization or death. So again, same principles apply as last year. We have an infection, let's quickly identify it, isolate that person, try to keep that entire team environment safe. But I think the message is clear. You're much less likely to get a COVID infection when you're vaccinated. If you do happen to become infected, it's much likely to be a less severe, it's likely to be a less severe form of illness. And again, we think it's much less likely to transmit around to your colleagues as well. So again, vaccination, the best weapon we have to keep everyone in the team environment safe.
And another tool, of course, is testing. And I know if you're unvaccinated, you're tested on a regular basis every day, I believe. If you're unvaccinated, it's more surveillance testing. Why not, though, given what you just laid out there with the breakthrough cases and so forth, test everyone every day, no matter their vaccination status?
Well, I think, again, this is something we have active conversations with our medical experts around, with the CDC, with other government officials, with the Players Association, their medical experts. And it's something we may be evolving. We'll just see what the data shows us. But, at present, CDC and others are not recommending routine testing of vaccinated individuals. So by doing some surveillance testing, we're already doing more than what's recommended currently, certainly more than what we do in a healthcare environment. But again, we'll follow the data, we'll follow the science. And if it seems that we need to test more frequently, then we'll adapt and adjust our protocols around that idea.
Okay, just last question for you. You've said that 5 clubs are under the 70% vaccination rate. Do you expect them to hit the threshold by the time the season begins? And can you tell us which teams they are?
I won't get into specifics, but I do think they will reach that threshold. I think, as I said, we'll continue to see our numbers go up, and I'm excited about the start we've made, and I think we'll continue to see progress there because we are seeing day-by-day movement on that. So, again, all credit to our players, to our coaches, to our medical staffs, to our Players Association. Everyone's pulling together to try to help us increase these numbers, and I'm very optimistic they'll continue to increase.
All right, Dr. Allen Sills, thank you so much for joining us for your time on this Saturday. We appreciate it.
Hey, thanks for having me.